anti-snake venom should be calculated that it should be neutralized. The average dose of venom can be injected by a snake. So that is important. And range of venom injection, mostly the range of venom, the range of venom injection mostly with 5 milligram to 147 milligram is the range. So you can and suggested average dose of anti-snake venom dose will be 100 to 250 ml you can administer it. So initial dose should be dose of 100 ml must be diluted in 100 ml of normal saline given over 1 hour of time, because you know that 1 milligram is 6 milligram of venom or 5 milligram of venom has been entered into your body. You need minimum 100 ml of anti-snake venom to neutralize that 5 milligram. So that is the initial. So 100 ml must be diluted first initially and administered. And important thing, the patient should be carefully monitored for 24 hours. The patient should be carefully monitored for 24 hours. And local, and so don't go for a local administration of anti-snake venom near the bitten site. So it is ineffective. The first thing is there is no effect of such procedure, but it is highly painful. Sometimes it causes severe pain and rise of intracompartmental pressure. So it will increases the intracompartmental pressure and causes more necrosis to the area. So it should not be done. So you should not go for a local administration of anti-snake venom near the bitten site. Often several days, if suppose patient is coming with us after several days, victim who has arrived late. Okay, so in such cases usually they will have an acute renal failure. ARF will be there. Where are there are any signs of current venom activity? You just go for any other current venom activity is there in the patient. You check. Perform the 20-minute whole blood clotting timing and determine if any coagulopathy or if any other symptoms is there, or if you can see if there is any then you can administer anti-snake venom. Coagulopathy is there plus other symptoms is there, you can go for anti-snake venom. But important thing, if the patient is having an ARF, acute renal failure, so go for dialysis. Immediately you go for dialysis. Suppose if it's a neurotoxic envenoming, look for ptosis. If a neurotoxic, you look for the ptosis, see that the eyelid has been dropped or not. Any respiratory difficulties there, respiratory failure is there, then you can go for the administration of 1 dose of anti-snake venom and with respiratory support. See that the person has been supported with to overcome the respiratory failure. You see that the patient has been supported with the respiratory support. So what are the AVS is safe? No, it will not be. So AVS can produce some reactions. So the patient should be monitored closely. The first sign of any one of the following is happening. See, check the patient for any sign like urticaria, itching, fever, chill, nausea, vomit, diarrhea, abdominal cramp, tachycardia, hypotension, bronchospasm, angioedema. Anything is there, discontinue the anti-snake venom. Give 0.5 milligram of 1:10,000 adrenaline intramuscularly. So if the person having any signs, such signs has been above the 12 signs, anything is precipitated, discontinue anti-snake venom, because it can further jeopardize the patient condition. So better discontinue the anti-snake venom and administer adrenaline 1:1000 ratio. You can administer adrenaline. So again, for a long protection, suppose this is for the immediate emergency cases, you can go for adrenaline. For a long protection, you can go for 100 mg of hydrocortisone that is intravenous, plus 10 mg of histamine, H1 blocker. Antihistamines can be given intravenously. Both of them can be given intravenously for the patients for a long-term protection. And again check after 10 to 15 minutes, patient is not improved. Check the patient for after 10 or to 15 minutes. The patient is not improved, he is worsening. Give the second dose of adrenaline, 0.5 mg of adrenaline intramuscularly. And when you start the anti-snake venom, in such patients, you start anti-snake venom only when the patient is recovered. Then only you can restart the anti-snake venom for 10 to 15 minutes slowly under close observation of the patient. So see that the patient has been closely observed and he has been administered the anti-snake venom. So repeated dose of anti-snake venom. So hemotoxic poisoning, in the case of hemotoxic poisoning, if the 20-minute whole blood count test is abnormal, initial dose is given after 1 hour, repeat the test again after 6 hours. If it is abnormal, then again give another dose and repeat the same dose regimen of the initial dose. So first take the patient, 20 minutes blood clot, the test has been done, 20 minutes blood clotting test has been done. If it is abnormal, initial dose can be given. After 1 hour, repeat the 20-minute blood clotting timing. After 6 hours, if again it is abnormal, again repeated the same dose of initial dose. And also you can again check the 20-minute blood clotting test and repeated dose of anti-snake venom to be continued after 6 hourly manner until the coagulation is restored. So you can repeatedly check the 20-minute blood clotting test and repeating the dose of anti-snake venom for continually for 6 hourly manner. See that the coagulation has been restored in the patient. Then only you can stop the anti-snake venom administration. In the case of neurotoxins, assess the patient for 1 to 2 hours after initial dose. Here there is no, we cannot go for any blood counting test. You assess the patient. Observe the patient for 1 to 2 hours after initial dose. If the symptoms persist or worsen, the second dose, which is the same as the first dose, can be given for the antivenom can be, then the antivenom can be discontinued. So observe the patient is worsened, the second dose can be given at the same as the first dose has been given as the anti-snake venom. So after that, then you can discontinue the anti-snake venom in neurotoxic patients. So what is the role of neostigmine in neurotoxic patients? So as we know that acetylcholine has a anticholinesterase has a prolonged life of ACH, which can reverse by the respiratory failure. So neurotoxic symptoms, especially postsynaptic neurotoxic symptoms, where acetylcholine can be released more and it can causes respiratory failure, or it can the postsynaptic release of acetylcholine is being depleted, so automatically which will causes the respiratory failure. So anticholinesterase like neostigmine, pyridostigmine can increases the half-life of acetylcholine, which can reverse the respiratory failure happens with the neurotoxins. So you can go for a neostigmine 1.5 to 2 milligram intramuscularly, preceded by an 0.6 milligram atropine IV. Observe for 1 hour. If the victim respond, that is, he has been recovering from the respiratory failure, then you can go for continue for 0.5 mg of neostigmine IM half an hourly with a 0.6 milligram of atropine IV over 8 hours. So what is the role of atropine? If suppose the neostigmine is going to be worsened, then atropine will take care of the such cases. If no improvement, if you after administration of neostigmine and neostigmine you didn't find any improvement, in the symptoms, after 1 hour you should not administer neostigmine further. It will worsen the patient condition. So supportive therapy, respiratory failure, you can go for arterial blood counters. You can do incubate or ventilation. You can do. You can also go for neostigmine atropine. If the patient having any hypotension developed, you can go for a plasma expander, or dopamine can be given if the hypotension has been developed in the patients. So these are the supportive therapy can be given in the snake bite. And persistent severe bleeding, suppose the patient is being his bleeding is persistent and severe, the majority timely used AVS will stop. Mostly the anti-snake venom will stop the systemic bleeding. So you can go for an anti-snake. If it is not stopping, you can go for an ASV plus blood transfusion. You can go for blood transfusion to prevent the shock or due to loss of blood volume, hypovolemia. If in case of renal failure, the patient has been have a renal failure, go for hemodialysis. Most of the renal failure, acute renal failure cases will be recovered after the therapy, especially when there is a damage in the cortical area. Cortical area damage happened, then the difficulty to recover the patient, you can go for a replacement of renal system. Replacement is necessary. And compartmentalization syndrome, fascectomy can be done, and required any surgical disarmament of wound. Sometimes a surgical innovation is required when suppose if there will be an high bleeding in the cerebral hemorrhage or such things has been happened, then the surgical intervention should be happen to the area. Or sometimes what happened, the local necrosis and the limb or the necrosis or the swelling has happened in the limbs, then tissue grafting, such things should be required. In there also you should go for a surgical intervention. So here we finish the snake venom, snake bite and snake venom poison.